Morning, everyone. It is 10:30, so we will get started with today's update. We do have a brief agenda this morning as there were a lot of calendar conflicts today with folks at different meetings. So we'll get started today with handing off the baton to Emily. And just a quick reminder, if you have questions today, please make sure that you put those in the chat to all panelists. It's all you, Emily.
Thanks, Heike. So I want to start with giving an update on our Partnership for Hope and our MoKids waiver renewals. They were submitted to CMS in April, and CMS did approve those waivers and the amendments, the COMP and CSW amendments to align with the renewals. Those were approved and they will be effective July 1 of 2023. We will have training for the waiver service definition changes. Those that will occur in the second and third week in July. And we are working on updates to the waiver manual right now so that we can get those to the process for those waiver manual updates is to go through MoHealthNet and MMAC and also through the division for approval. And then that will be posted, that waiver manual will be posted for all of our stakeholders to review. Just to go through, and I know we've kind of said these changes before, but it's always good to hear them again. For the waiver renewals, we did make remote supports a standalone service. It has its own service definition, its own service limitations or maximums for the individual's maximums and requirements around remote supports. We also added virtual delivery of service for our 5 employment services. That's supported employment, benefit planning, career planning, job development, pre-vocational services. We also added virtual delivery of services for our applied behavior analysis services, physical therapy, occupational therapy, and speech therapy. With the virtual delivery, there are assurances for providing the delivery of the service virtually. Those assurances are in our waiver and will be part of the manual for requirements around giving individuals choice for in-person versus virtual, requirements around HIPAA, and requirements, one that I think of off the top of my head is the requirement to have that face-to-face or the virtual face-to-face. It can't just be telephone virtual delivery. It actually has to have an aspect of video with it. We also updated the environmental accessibility adaptation, home and vehicle modification service definition to clarify the use of service funds for provider-owned and leased vehicle adaptations and maintenance for those vehicles when waiver funds can be used for that. We removed remote supports from our assistive technology service definition. We also increased the maximum units amounts for 2 of our ABA services, the behavior identification assessment and behavior assessment, and the behavior identification supporting assessment observational service. Those 2 services had increases in their maximum limits, and we added the QHCP provider type to the adaptive behavior treatment by protocol by technician. And those were all changes that are supported by what also state plan to mirror what state plan allows. We clarified that the MOS assessment is the preemptive assessment for determining substantial functional limitation. And we also updated references to the UR committee to the UR process, which is to match the updated CSR, or the regulation. So those are the main, some of the major changes with our waiver updates. And again, be looking for registration for the trainings in July for those changes in the waiver. And then I wanted to also mention today for EVV, or electronic visit verification requirements, which is a requirement for all personal assistance services, that providers are required to use EVV when providing the PA service. Part of the EVV record requirement is completion of the memo field. And I've mentioned this before in our all calls, that that memo field is a requirement with meaningful data, meaning that it's something, data that is related to the service that's being provided for that individual. One of the upcoming changes with that, though, is that in August, the EVV aggregator system will identify all EV records without a completed memo field as unverified. So right now, those records that are going over without a memo field, they will, right now, they will say verified. Coming August, the aggregator will require that that memo field is completed, and it will mark the record, the EVV record, unverified unless there's information in the memo field for the record. To complete a visit or update the record to a verified status, the visit must be resubmitted to the aggregator with a memo of a completed memo. For providers who use telephony systems, documentation requirements are the same. You will still have to have a memo field completed even if when using telephony. So there may be some additional concerns around entering those memo fields, and you'll have to providers must work with their EVV vendor to ensure that they have the capability to submit a memo field. One last thing about EVV, as part of the MMAC revalidation and initial enrollment, MMAC is also requiring PA providers to have an EVV vendor assigned. They must have an EVV vendor on board, and they must utilize the aggregator to complete the revalidation, or if you're a new provider coming on board, to enroll as a PA provider, personal assistant provider. And lastly, just a quick reminder about the consumers in the Healthy Children and Youth program. This program, the Healthy Children and Youth program, is a program that is administered by the Department of Health and Senior Services and Special Healthcare Needs. And the program, the HCY program for short, program provides service coordination and authorization for medical necessary in-home services for MoHealthNet recipients with special healthcare needs from birth to age 21. Recently, we have received some questions about, can an individual receiving HCY services, so it would be children or individuals up to age 21, from birth to 21, can you have both HCY services and waiver services? And the answer is yes. You can get HCY services through the Department of Health and Senior Services, Special Healthcare Needs, and have a waiver. If you have questions about that, if you have an individual and you're not sure, please always ask about that. I think there's been some confusion where individuals and their families have been told they can't have a waiver service and HCY services. And there may be some confusion around one thing that you cannot have is two waivers. So you can't have a DHS waiver and a DMH waiver. But this is HCY services, which is different than a waiver. And that just a reminder that HCY services end at age 21. So those are my updates for today. Let's see what we have for questions. There's a question about the UR desktop reference being updated. FPU does not update that, but I don't know if that's currently still being updated. I will have to reach out to the UR director to inquire about the UR desktop reference. And we can provide a response back to the individual who asked that question. So there's also a question is, can you please give an update on when all the rate changes are complete in Seymour so we can enter the July 1, 2023 contracts? And can we, so that they can enter contracts for station D nursing, SDS contracts and that sort of thing. And Wanda gave me sent a response to me that that is in process right now. The rates are in process of review. The division is finalizing those rates. I will say, however, they will the intention is for those rates to be effective July 1, 2023. So they will have to be finalized in the next week or so. I think that's all I see in there for right now. I'm going to hand it over to Leslie.
Thank you, Emily. Good morning, everyone. I'm Leslie DeGroat, the Division Statewide Clinical Coordinator, and I have a brief health reminder and then some updates to share. I'm going to first share my screen. Oh, thank you. They handed me the little folder thing to do that. Okay, I hope you're seeing my screen. It is our education site. I just wanted, this is just something super important that is oftentimes overlooked, but it's our oral health. It's very important. It's an important part of a person's overall health and well-being. In 2017, we received a grant from Dental Trade Alliance Foundation out of Arlington, Virginia, to create brief videos that demonstrate the importance of oral health and how to assist other people with oral hygiene, because that can be quite challenging. So we'll drop the link in the chat to our education page. See, this is it right here. Then you go down to the videos ribbon, and it's got all these three. They're very brief, so it's not like you're going to have to sit, forever, but just these 3 videos that will hopefully be beneficial to people dealing with oral health and hygiene. Let's see, look at my notes here. Let's see, the first video is titled Special Circumstances with Oral Hygiene for People with Intellectual and Developmental Disabilities. That's geared for people with intellectual and developmental disabilities, their caregivers, and their families. It gives an overview of what a dental hygienist does and the importance of oral health as it relates to your general health. Some interesting tidbits in there that I did not know before. The second video is titled Special Circumstances with Oral Hygiene for People with Intellectual and Developmental Disabilities. And that video gives guidance on special circumstances related to providing oral hygiene, such as how to assist people who maybe they avoid oral hygiene tasks. They don't really like to brush. It talks about how to complete gum care. Like, let's say someone doesn't have any teeth. What do you do to keep their mouth fresh and clean? And then also how to assist people who do not take food or fluid by mouth. And maybe they just, like they'll have a G tube or a gastric tube for nutrition. It talks about how to safely provide care. The third video is titled How to Assist a Person with Intellectual Developmental Disabilities with Oral Hygiene. And it gives a demonstration play-by-play on how to assist someone else, because that's kind of awkward if you've never done that before, right? So it walks you right through how to help somebody else, but while respecting their independence and just using just really positive and encouraging approach. So hopefully those would be beneficial for you all to review. Another thing that I want to point out is that sometimes it's hard to help people with their oral hygiene. And sometimes people might fight about it. They just don't want to do it, or something about it they don't like. Well, there is a link that we'll put in chat, and it is a 1-minute video from the American Dental Association. And it talks about how the foods a person eats can affect their general health and the health of their teeth and gums too. So sometimes if you can't do thorough oral hygiene, perhaps maybe less sugary drinks, just different little tweaks that could possibly assist a person and decrease their dental caries and have just an overall healthier mouth. So I just wanted to share that. I found it and I'm like, well, it's nice and brief and it just hits the points, the highlights here. It's the Dr. Maria Lopez Howell is a dentist with the American Dental Association. So yeah, I just thought that'd be neat to share with you all. Now I'm going to switch gears and give a HRST or health risk screening process update. I'm going to go to our website here. So we started phase 2 of our health risk screening process. That implementation phase was May 1st of this year. Phase one of the process took place between March 2021 and April 30th of 2023. And, as you know, that's when residential service providers and support coordinators could go ahead and implement the process on a voluntary basis. Phase two entails each individual with a waiver through the division having that process implemented with them. So if you have not implemented the process already or onboarded, please reach out and we will definitely help you get started. Do not fret and do not delay. We'll help you get going. We've got a lot of things that we're working on to help you all with the process. We're working with Developmental, the Hearst company, to get the support coordinators a way to be able to just have their caseloads, to be able to pull reports on them and monitor them, and looking at how like supervisors and such can help monitor things as well. So we're working on that, and I'll give you updates as we go. Let's see, we're trying to make it easier. Yeah, like I said, to be able to monitor caseloads. Also getting ready to post our updated frequently asked questions document. We've been collecting questions and all kinds of stuff from the field, and it's a lengthy document. I might have to have a table of contents, but it's got some good information in it. So we'll be posting that soon. And then this is a super exciting update because it's been something that has come up just in the past week or so, well, maybe a couple weeks, but it's for support coordinators and them not being able to complete screens on certain individuals because in Seymour, somehow they're linked to a residential service provider. They may not be having residential services, but for whatever reason. So anyway, I just received a message from Developmental, the Hearst company, stating that they deployed the solution to that last night. So if you've had that issue, please check in the system when you can, and you should be able to go forth with implementing on that person. So I'm just excited to share that. They were able to get right on that and put it as a priority to resolve. And so I'm just pretty pleased with that. So let's see. I want to pull up contact information. Please, anytime specific issues, anything, Hearst, anything. moddhurstproject@dmh.mo.gov. Don't hesitate to reach out. I mean, literally, don't be out there going, oh my gosh, reach out. If you're having any technical difficulties, most support at replacingrisk.com. That's also one that the gatekeepers will want to use when they're changing roles and different things. And then Moclin assist at replacingrisk.com. That's in relation to raters. Raters can always reach out to that and get some assistance, coaching, whatever, anything just to help, get going, build that foundation and move forward with that process. So anyway, that is all with Hearst, and I'll answer questions. I see some questions popping up, so I will get to that here in just a jiffy. Oh, I wanted to share. Let me see if I can click on that. I've got a little dealie in my way here. Okay. Now this is our webpage for previous webinars, and this happens to be right on top. Nothing is available yet, but there should be a recording that reviews this. So on June 14th, the division's DD Community Health and Wellness Coordinator, Tricia Parker, and Division Research Analyst Adil Khan presented a webinar for new RN orientation and reporting of RN new hire and vacancy. As you can see, it's titled Division of Developmental Disabilities Residential Service Provider Notification of Residential Oversight Registered Nurse. Let's see. And it wasn't quite an hour long, but it highlighted the notification process enhancements for contracted residential service providers, like when there's a residential oversight RN vacancy or a new hire. The enhancements are intended to streamline communication to the division, improve the residential oversight RN orientation process, and then support waiver residential service participant health and welfare. And that enhancement went into effect yesterday, actually, June 15th. The target audience was residential contracted providers, provider staff, and external stakeholders. And as I said, the webinar presentation or transcript, they're not quite ready yet, but they will be posted. So you can always click on that and it walks you right through everything. There's a demonstration on, getting into Red Cap and reporting it. And it's not too complicated or anything. So it's just to help us also keep data on NERN vacancies, just to kind of bolster, what we're doing and help make things more efficient and such. So that's my update for that. Actually, that's all my updates, but I'll look at the box for questions. Stop sharing. Remove this here. So I'm looking at you and not looking over there. Okay. And thank you, Kat. She said it'll be posted in a few days. Okay. Sorry, I scrolled through the whole thing just to make sure I didn't want to miss anything. Oh, this is good. We are having a number of, well, it's not good, but maybe eventually they can always change their mind. But I can answer this. We are having a number of waiver consumers adamantly decline doing the Hearst. It's new, and gosh, thank you for trying. And maybe eventually they'll come around and let allow it. But it's a person's. What are you going to do? Regardless of how we try to explain it, is help their loved one. How do we document this in the Hearst portal? There is a training titled, hang on, let me see if I can have it memorized. It's really long. Hearst Resources for Individuals and Families in Managing Service Declination. It is 6 minutes and 17 seconds. I have it memorized there. And it should be in all support coordinators training library, and it will walk you through exactly what to do, like step by step what to do and where to document. So if you haven't already, check that out and it'll get you right through it. Wow, that's the only question I'm seeing. So, but seriously, if you guys have any questions or specifics or whatever, reach out to that MoDD Hearst project at dmh.mo.gov, and we'll get back to you. And I think, am I turning it over to Holly now?
Actually, you are the shining star to wrap up today's call, Leslie. So I do believe there is
being a shining star.
I do believe a couple questions just came in really quick, though.
Okay.
While she's looking at the chat, I did want to give an update on the question that we got about will the UR desktop reference also be updated? I got a response on that, and it is in the process of update and review right now.
Here is, besides saying the Hearst helps with linking to Station MD, what other selling points can we tell parents to persuade them to do the assessment? Honestly, just speaking from the heart, identifying those risks that a person might have, and just being able to plan for it and help keep that person in their home longer and keep them healthy and stable. And I mean, it's just sort of a screen and asking questions. And well, you guys know, you've been in there and seen it. But really, that's all it is. We want people to have what they need so they can stay in their home. And I mean, I've read so many different mortality reviews where it's like, oh my gosh, if that just had been flagged, that person may not have had these consequences, may not have had to go to the hospital and be in ICU and all that traumatizing stuff, and then maybe end up passing away. Sorry, you don't have to get that, over the top with it, but just identifying those health risks and just helping to keep them out of the hospital and helping them stay in their homes and be happy and healthy. And we are working on, I know I've been saying this forever, and it takes a while to finalize some things, but we are trying to work on supportive things to help support coordinators have that conversation and be able to bring it to the families and yeah, but I appreciate all that you're doing out there. I know it's new and it's hard, and sometimes it's hard to understand the whys behind it, when you're trying, well, and the families, try to explain and stuff, but please give me any feedback that you have, and know that we're working and we are with you in this. Okay. And we are working on a support coordinator assistance document, but it's just not finalized yet. But as soon as it is, I will make the announcement, and hopefully that will be helpful for you. But thank you for sharing that or bringing that up. And then here is a question. If a residential provider And then if someone refuses to do the HRSA process, do they follow that same process? And actually, the nurse and the direct support professional or whoever knows that person well should know the person well enough to be able to complete that screen. So I should have clarified that at the beginning for a non-residential, like the support coordinators, they wouldn't be able to complete the screen without that family input or the individual's input. You know what I mean? I mean, it would be impossible. You'd just be guessing, right? So you really can't do it. But as far as for residential service providers, that's kind of a different story. So yeah, so that's what that looks like. So. Okay. I'm gonna check and make sure. Oh, someone commented, thank you, I appreciate it. They're trying to be cheerleaders, pushing that they're really wanting to have positive health outcomes in their lives. And this is one tool we can use to help with that. Oh, thank you. Transitioning into residential, allowed to decline the HRSA. If they're residential, they need to have the HRSA process implemented. Ooh, here's a good question. And I like this feedback, and this is something that we've brought to the table. We're talking about it. Has there been any update on HRSA system in which the meds appointments can be saved month to month for you for the RN summary instead of RNs retyping everything into the system each month? There are a couple of spots that will carry over month to month. You shouldn't have to retype all the medications in though every month. So if that's happening, please let me know. She shouldn't be having to do that. So, but yeah, we are talking about that where, well, someone had mentioned labs, saving labs month to month, and so they can be tracked that way. So yes, any ideas that you guys have for enhancement, we will totally talk about it and consider it. And then HRSA is replacing the health inventory screening for residential, correct? And that is correct. There will be no more health inventories. There shouldn't be any completed now after April 30th. So yeah, no more health inventory. It's just implementing the health risk screening process. And I think I've got them. Okay. Okay. Some feedback. Oh, okay. One more. Has there been any progress to allow comments to the RN directives? And that would be from the DDP or the support coordinators. Because currently, if the RN has anything that they are recommending, then they need to respond to that. Discussion. It's in discussion right now. So just adding a comment field perhaps or something like that, just so that documentation is right there that, okay, yeah, I did follow up on that. So yes, and I appreciate that feedback too, because you guys are out there doing it. We need to know what you need, to close the loop, you might say. So, okay. I'm not seeing anything else, but don't hesitate to reach out. Oh, okay. Does the RN summary still need to be sent if it is in HRSA? No, everybody should be getting access. The support coordinators should be able to log in and review it. So nothing should have to be sent. So they need to go ahead, and if they don't have access, they need to get access so they can see the stuff in the system. Okay. As soon as I say, I don't see anything else, something pops up, which is fine. I might wait in just a second. Otherwise, I think we might be able to close for today. Seriously, though, reach out anytime, okay, to that mailbox. And we appreciate you and have a great weekend.